Doctor, I've been taking medicines for my tooth decay and gum problems for the longest time and I'm still not availing any resolution because of the fact that I've been taking the medication for so long. Till the time the medication lasts, the effect lasts, I'm in relief and then it comes back, the problems come back. What do I do? Hi, my name is Dr. Rudra Mohan and through the Oral Health channel, let me talk to you about why just medications will not work for your oral and dental problems. Let's start. So I get a lot of comments from my patients and my viewers that, I've been having tooth decay and tooth pain and, gum decay and gum problems for the longest time, and I've been taking continual, medications for the same, but I'm still not having the kind of relief that I'm supposed to get. Now, the relief is temporary because the effect of the medicine is also temporary. I'll give you a very, very simple example. If you're using watercolors, if you take a glass of water and then you put a little bit of watercolor, the water turns the color of the watercolor, right? Same thing if you do, you take a huge tank of, or a swimming pool rather, of water, and then you place the same amount of, color into swimming pool. It might get tinged to that color, but not completely. And now let me take a further, ahead example of the sea. You go to the seashore and you see that the waves are tethering towards, the beach. And you put the same amount of color on that and you just see a very small circumscribed area where you get the color tinge, and then it dissipates away as the waves wash against the shore. Now the similar thing happens in your oral cavity as well. The environment is very, very dynamic because it is composed of blood vessels and the dynamic is very fluid. Now when it comes to tooth decay, the tooth decay actually usually starts from the enamel, goes to dentin, and then goes to the pulp. The pulp is the living tissue or the living organ of the tooth, which provides nutrition and as well as sensations to the tooth. Now what is happening is that if you are just taking medication without removing the actual decay by not getting the tooth drilled and filled or getting a root canal treatment rather, then what happens, it's very simple. You're going to be having the same effect as what you do when you place that same amount of watercolor on the seashore in the waves and it gets washed away. So till that time, that area you might get a temporary relief from, but until unless there is mechanical removal of all the decay and all the matter that is causing the problems, the bacteria and all these things needs to be cleansed out and cleaned out by the dentist professionally, you will just have temporary relief. The same thing happens with the gums. When you're talking about the gums are even more dynamic environment with a lot of moisture and a lot of blood vessels involved. And that is also the same thing, that if you're having plaque and bacteria and tartar below the gums, and that is causing you a lot of problems such as gingivitis or periodontitis, what is happening is until unless you get a cleaning done or a deep cleaning done or a surgical procedure done like a flap surgery for gum problems, you are not mechanically removing the toxins and the bacteria and the local factors that are contributing to the disease. You are just putting a band-aid on a stab wound. This is what I like to actually quote to all my patients to make them understand. A medicine for dental decay and gum infections is like putting a band-aid on a stab wound where you actually need stitches or a surgery. So this is very important for you to understand that if you are not yet enlightened by this and you're watching this video for the first time, please try and understand that any sort of oral infection requires a mechanical removal, be it tooth decay, be it gum problems, be it periodontitis or gums disease or gingivitis, anything if you name it, it requires professional intervention. So this was today's episode. Please like, share and subscribe and press the bell icon for important updates. If you want to do a teleconsultation with me, please do not call me directly. I might be busy with the patient. Please leave me a text or a WhatsApp or any of the social media handles through which you can contact me, and then we will set up a suitable time for your consultation. So that's it for today. Please like, share and subscribe. Thank you.